My name is Sue Sisley, and I'm a physician from Arizona. And I practice internal medicine and psychiatry. I'm also the principal investigator on a marijuana study looking at veterans with PTSD. And sadly, this study has been blocked for many years, but in the meantime, I've learned a great deal about marijuana as medicine from listening to my patients, and I wanted to share some of these insights with you. First of all, I want to commend our partners who are here in the room. We have so many wonderful stakeholders that I've been really honored to meet over the last few weeks, over the last day, who, and many of these are devoted patient stakeholders who are trying to help bring the idea of marijuana as medicine to Illinois and make sure that the law is implemented properly and expanded sufficiently to enable all severely ill patients to have access to cannabis. I'm from a state that has had medical marijuana law now for over 4 years, and I'd be happy to talk with you about our experience, but we're a very conservative state, and we've managed to unroll our medical marijuana program in a way that keeps it truly medical, that's avoided, this program veering into a recreational realm. And we're excited at the opportunity to help consult with Illinois and possibly provide them some guidance as a state that's been through, many years of trying to optimize our program. So, and I was a consultant in the rulemaking process, and now you guys are embarking on your own rulemaking. Today we're here testifying to add certain conditions to the list of qualifying diagnoses. And I'm here hoping to testify about adding PTSD. In my own medical practice, I've been treating military veterans for about 20 years. Also, I take care of a lot of police and fire that have documented PTSD and are struggling to find treatments that are effective. And I'm really interested in studying more about how marijuana could be used as monotherapy to treat this very complicated syndrome of PTSD. So I'm hopeful that today the board and the governor's office will consider adding PTSD. We did that in Arizona. I was really lucky to be participating in the petition in Arizona to add PTSD in January of this year. We finally added it, and it's been a real gift to PTSD sufferers throughout our state who have not been able to find effective treatments for their PTSD. They've been seeking out marijuana and successfully using it for symptom control, so I think that's really important. The reason I'm wearing this dog tag is because the military veterans around the country have put together a campaign. Instead of a ribbon campaign, they decided to build awareness using these dog tags with the number 22 engraved in them. So 22 signifies the number of military veterans each day that kill themselves in this country. This is actually believed to be a low estimate. This is the number that the VA administration put out in 2014. But we all know that there is a very serious epidemic of veteran suicide in this country, and it is possible that marijuana could help curb that suicide epidemic. We don't know. That's why we're desperately trying to study this. But you can't study this plant in an atmosphere of prohibition, and the problem is that when PTSD is not added, you can't study PTSD then, because you're asking PTSD sufferers to come out of the shadows and admit they're using the drug on the black market. So it's really crucial that PTSD and these other conditions that are represented here today, that we create an allowance for these other diagnoses to be added so that all sick and debilitated patients can have access, safe, legal access to lab-tested marijuana.
I'd like to thank all of you for showing up here today. I really think that we're making some progress on some real important issues here. Obviously, I'm here in support of post-traumatic stress disorder and cannabis being one of the tools to combat that. A little bit about myself. I'm currently a veteran peer support specialist. And I was telling the folks downstairs, one thing different between me and a regular provider at the VA is that the guys who come to me, the gals that come to me can be honest with me. Okay, so I have our aspect is quite confidential in the concept that a lot of veterans are uncomfortable with telling their providers exactly what it is that's going on with them, or exactly what it is that they're doing to combat that, such as cannabis. And so what we see is a real disconnect in the VA, because veterans are afraid to tell their doctors what's going on with them. They're afraid to tell them that they're using cannabis. They're afraid that they're going to be, kicked out of the program or kicked out of some inpatient program because of this. So this also kind of relates to my experience when I left Iraq. I was a patrol leader in Iraq for 10 months. Our team went through, random ambushes, attacks, IEDs, small arms fire, incoming rounds, all the things that you kind of expect when you go into combat. Now, when I left Iraq, I was kind of in shambles. My nervous system was completely fried. One of the problems that we have is the physiological aspects. Your body changes completely when you go into combat. There's a lot of things that mentally you do as well, and that's shut yourself out completely emotionally, which causes a lot of problems when guys get home. That and drinking too much, frankly. So there's this kind of cycle of depression that ends up happening as guys get back. They want to spend, the first few weeks partying because they're home, they made it back safely. But what happens is it tends to be a problem, because it starts out as going out for a few drinks, but eventually it turns into guys who are sleeping or drinking just to get sleep. And so the issues that I dealt with when I got back, the anxiety, the depression, insomnia, restlessness, hypervigilance, all those things, the VA's approach was, we're going to find a way to medicate you. And so it starts off for the first year of the VA spending, 5 or 10 different medications to try and, fix these symptoms that you're having. And the reality is they all come with negative side effects, and some of those are deadly. And so I think it's about time that we start, treating veterans as the heroes they are rather than criminals, because they turn to cannabis as a way to relieve those symptoms. Now, with the VA, the medications that they prescribe, they're meant to be temporary. They're not meant to be something you take for the rest of your life. I can't say that cannabis is the same, but what I can say is that I know from personal experience that it's beneficial, and it's more beneficial with less side effects than we have with the other medications that they're prescribing. Thank you.
I'm a neurologist in Chicago. I have especially training in neuromuscular diseases and clinical neurophysiology. For the past 10 years, I have been doing research in peripheral neuropathy, mostly diabetic neuropathy, research dealing into the diagnosis and proper treatment. I was also the co-chairman of the American Diabetes Association Latino Initiative to do workshops and to talk about the evil effects of diabetes into the nervous system to the Hispanic community. During my research career and my clinical career, I've encountered probably 99% of my patients that come to me have been medicated, over-medicated at times, cocktail medications, and you know the medication I'm talking about, from opiates to anticonvulsants to mood stabilizers. And it is my opinion that none of these drugs, in spite of what you may read or hear, work. The side effects are abominable. Most people don't tolerate them. At the beginning, maybe yes, maybe no. But after a while, there's tolerance and there's adverse effects. We do not have an alternative medication at this point. These people are desperate. They come to me willing to be amputated because of the severity of the pain, and I don't see any way for them to be treated with any other conventional medications, which, as I say, in my opinion, they have failed. Injections, spine stimulators, things like that, they do fail as well. So I am here today just to try to ask for a possibility of using this kind of herb as a medical alternate choice.
Good afternoon. My name is Tom Lee, and I was diagnosed over 40 years ago as a type 1 diabetic. Now, diabetes is an autoimmune disease, and that's something that's not often said. A lot of people think it has to do with a weight issue or something like that. It's a misnomer. But a common side effect of the diabetes is something I suffer from, and that's the neuropathic pain as well as migraine pain, migraine headaches. What this means is I have severe pain in the shins of my legs that make it difficult to walk. Some days are worse than others. Right now I'm taking prescription drugs, and I have been for many years. Sometimes they help to alleviate the pain somewhat. Sometimes they just don't seem to work at all, and the side effects can be really debilitating. For anyone that suffered from migraines, you know that you feel like your head is just kind of in a vice, and you just want to go into a dark room, shut off the world. In 2008, I was severely injured, which left me paralyzed for a week, and I faced a 2.5-year period of rehabilitation and recovery. It was a difficult time, but I did get a lot of support. I don't like to keep secrets, but I had to because I found that cannabis helped me deal with some of these conditions that I was suffering from better than some of the medications that were prescribed to me. I didn't want to keep secrets, but I had to because it was illegal. And I finally found something that helped me relieve my pain, but to continue doing so, I would be breaking the law. When I used cannabis for my pain, my wife, my family, even my friends had no idea. She just thought I was having a good day, and I was. But I try to be a good citizen. I look out for my neighbors. I look out for my friends. I'm a taxpayer. I'm a voter. And I just try to do the right thing. Even though cannabis has changed my life, it was going against my grain. It just really began to kind of plague my mind. I never felt like, I couldn't imagine what it would be like to get arrested, and I thought, how would this impact my ability to get a job? And how would this impact my family? What would my wife think? What would my friends, my neighbors think? I want you to think about how that would make you feel, alone, isolated, conflicted. So I stopped using cannabis for the fear that I would impact the people I love, at the expense of my own well-being. Now I have hope, but there's kind of a carrot dangling out there. Illinois says it's legal for use to use medical marijuana, but only for a select few. Not for diabetes, not for diabetic neuropathy, and not for migraines. None of my conditions are eligible for the treatment. So I asked Governor Rauner and the Medical Cannabis Advisory Board to hear my story, to hear our story. Because I'm not the only person up here suffering from the conditions. Between the diabetes, the migraines, and the nerve pain, I've tried over 20 prescriptions, which take a toll on my body, my mind, my spirit. I would be drowsy. There were terrible side effects, including some memory loss of emotion, being lethargic. I really at times felt like I was losing my mind, and I started to feel like a zombie. So that was what pretty much led me to try to use marijuana as an aid. To sum it up, I want to live my life the same as you do. The only difference is I want access to medical marijuana. Thank you.
My name is Amish Parikh. I'm the Director of Development for My Compassion, which is a public charity nonprofit whose mission is to increase awareness and understanding through education, information, and advocacy of all the medical benefits and healing properties of medical cannabis with common sense public safety training. My Compassion has seen thousands of patients helped by medical cannabis whom have become functioning members of society, as will happen for many more in Illinois when more conditions such as migraines, PTSD, and other conditions are added to the qualifying conditions list. If you're a healthcare professional, a caregiver, or a patient, My Compassion is hosting a community meeting at the Muir North Library on May 6th for healthcare professionals from 2 p.m. to 4 p.m. and patients and caregivers from 5 p.m. and 7 p.m. And the topic will be cancer and cannabis. For citizens of Illinois to get involved, please sign the petition for medicalcannabis4il.com. That's the way to take action. Thank you.